If you have the option to get your groceries delivered to you, that's definitely a safer way to go than going to the store. And I certainly recommend that for older individuals or people who have specific health conditions that put them at increased risk of COVID-19.
We want to make sure that people do have an adequate supply of nutritious food. And so I don't think people should be unduly concerned about going out to the store and buying food.
Try to find a store that limits the number of people, the number of customers who are allowed into the store at a time. If you can find a store that clearly is paying attention to providing precautions for the workers at the store, who are giving them barriers to stand behind or providing them with masks, that's a sign that they are paying attention to the people who work there and they're paying attention to their customers.
Plan ahead, make a list so that you know what you're getting. You'll have a game plan when you're there. You'll be going less often. The important things to remember are to, after you've touched something, try not to touch your face.
The contaminated glove or the contaminated hand can transfer the virus in much the same way. And what this all really boils down to is that washing your hands at the end of that process is the best point at which you're removing the virus.
The main way this virus spreads is through respiratory droplets. Those are the droplets produced when you cough or sneeze, and you're most likely to get those if you're in close contact to another person, defined as within 6 feet, for at least 10 minutes. So I would pay much more attention to social distancing and worry less about what you touch.
So I think masks would potentially lower your risk, but in general, I think going out to the store, if you're maintaining distance and washing your hands, it's relatively low risk.
Those masks may be more helpful at preventing me from expelling droplets that might expose other people. Probably one of the places where there's the greatest opportunity for interaction is at the checkout. Self-checkouts are one option. A lot of grocery stores are setting themselves up so that they provide some guidance for distancing while you wait in lines.
I don't necessarily recommend wiping down packaging. I think kind of continue to do the same sort of things you would be doing anyways. You should be washing your fresh fruits and vegetables and produce.
I think the chances of getting coronavirus by eating something that might have coronavirus on the surface is vanishingly small.
If trying to clean and sanitize things we bring into the house leads to using chemicals that we might cause inadvertent harm from, then we want to discourage that process.
If you can plan your shopping and go only once a week or even go once every 10 days, it just minimizes how often you're around many other people.
What's really important is that people pay attention to what the public health officials are saying and recommending, and sometimes recommendations may change.
If you do go out, keep distance from other people, and that 6 foot distance really is key, and wash your hands when you get home.